Hi everyone!
Hi!
So today I'm talking about Dysport and Botox, and I thought that Shelly would be a good person to come on with me live because you never had dermal.
No.
Oh, well, you had fillers
yes.
in your lips.
Yes.
You like it?
I love it. But no Botox.
Never had any Botox, so I thought that, so because I'm talking about Botox, you never had it, so maybe if I'm explaining you how Botox works, and if I'm not clear, well, you can ask me a question.
Yes,
Sounds good?
Absolutely.
Okay. So that's what we're going to talk about today. It's really what to expect when you're coming in. So I guess the first thing I'm going to talk about is maybe how to get ready for your Botox appointment. So the first thing I would say is probably do your research, to be honest. Like, just kind of look it up a little bit. You need to make sure that you're going to a clinic that have experience, that you feel comfortable going. And that's really, really important. Also, I think you should really look into like who's doing the injection. That also really matters. So do a little bit of research before coming and make sure that it's for you, right? I would also make sure that you maybe don't jump into Botox the first time, or Dysport, or any kind of cosmetic injection, because maybe just do a consultation even prior, because for some clients, especially young client like you, because I do get people your age asking for Botox, and it's not that I'm against it, it's just sometimes maybe a little bit of skincare, proper lifestyle can make a huge difference, because like the movement in our face, okay, we had that since we were kid. You have movement, okay,
right.
But up to 25 years old, your body still produces collagen and elastin, and that's why now you start creasing, where when you were younger you were not creasing. So the first thing I usually look at, it's the quality of your skin. So maybe Botox can help, but maybe just investing in the right skincare could make a huge difference. And the right skincare, it's medical grade. So usually it's a medical grade vitamin C, vitamin A. I think that's really important. A good sunblock. That's a foundation, because a good skincare regimen will never replace, that's why it's important. Okay,
right.
That's the first thing.
And Botox, it doesn't change like the quality of your skin, right?
It doesn't. It only relax the muscle.
Right.
So you cannot come. Right now I have Botox, okay? So I can't really, well, it's wearing off a little bit, but I can't frown. I can't be mad. You can. You know. So see, I can't do it. Right now I'm well, I don't think I'm really due for Botox, but you can see I'm still having movement in my forehead. But see, I don't really have creasing. When I relax, I don't have creasing. And the reason why is because I have, I invested in the quality of my skin and all that. And I do get Botox, but now, 10 years later, I need less Botox than I did 10 years ago.
Right.
So that's why investing in your skin is essential. It's a priority.
Yes,
right?
Definitely.
So let's say that maybe first you came for consultation, you're really comfortable with us, like the injector, we answered all your question, and you're ready to go. So, and you have the right skincare. Right. So what to do next? So make sure that you didn't get that you're not on any blood thinners. It will not really affect the results, but it can make you bleed a little bit more. If you do take blood thinners, let's say for medical condition, please don't stop, but maybe ask your doctor if it's okay, or what to expect. But things like aspirin, Advil, actually just high dose of omega-3 and like vitamin E are all things that kind of make your blood thinner. So I would kind of suggest to stop that. If you know that you're easy bleeder, maybe even just requesting when you come a little bit of ice to put it on. That also help the bleeding. But I mean, pinpoint bleeding, a little bit of bruising, that's kind of expected. So just be mindful of that. Not a good treatment to do the day before your wedding, So, and that's another thing to take in consideration. If you have like a big event that you need to look your best, maybe do it about a month before.
Yes, good to know.
And even like if, let's say it's your wedding, maybe try it like once before your wedding, because there's always like there's risk associated to any kind of cosmetic injection.
With everything.
So I would, I don't think it's a good thing to just start doing like so close to a big event. So maybe come about like 6 months prior, try it, make sure you like it, because then like the Botox only lasts for about like 4 months, so then it can wear off completely, and then you do it again, or do you know what I mean, like something like that. Just be mindful that stuff may happen, and it's good to know. So that's one important thing to know before. No blood thinners. Just be mindful also that 24 after, like no heavy exercise, sweating, hot tubs, saunas, anything like that. So just you need to chill for 24 hours after. So those are all important things.
Yes.
Do you think I forget anything that's really important that you need to do before and after appointment? I think it's mostly that. Like, you'll have to do the exercise after, like round and right, just for the Botox to go all over your face. Those are important exercise because we want to make sure the product goes deep and goes in your muscle. So it's about like 10 minutes every hour for about 4 hours after. But it's pretty much it in terms of what to do before your appointment for Botox or Dysport. So now that you know that you're coming for a consultation, you're happy, you decide to go ahead. The first thing you'll have a consultation to make sure that we know the game plan. We come up with that game plan. Then you always meet the doctor at first. We evaluate your health history, making sure that you're okay to go ahead with the treatment. We do that, and then they're going to mark your face with little like pencil. It's a white pencil. I think I have one here, just like an eyeliner. I'm trying to find one, just like something like that, and we'll mark your face. So we know where to inject, so we can kind of come up with like the game plan. So we inject the mark, and
you can do it on me if you want.
Okay, so let's say you want to do you make funny. So you're coming in, and then you're gonna ask a frown, and then you go surprise. And then we ask for the sandstorm. The sandstorm. So see, let's say that you want to do your crow's feet, like you would do kind of like that's not a good point. So you just do a little point here, like you have like no wrinkle whatsoever, but and it would be more here actually. Let's say you want an eyebrow lift. Yeah. You would just, do the little dot here. Okay. And I'm not the one who injects though, so if there's someone that no one, like I don't inject, so I'm just showing. And then same thing, we have to frown, and then like there's like we could put like one dot here, one dot there,
Definitely.
And then, a little bit here and there. So we kind of put the game plan, like surprise, or here, we go here and there. See, we'd kind of look like this. So yeah. See, that's what we would do. You see that? Yeah.
Okay, so that would be my recipe.
Yeah.
Like my little plan.
We're not going to inject her today. No. So now that we have the game plan, we would tell her like how many unit we put in each of the little dot, okay? And then we would kind of tell you a budget. Okay, like it's going to be like $205, $25, well, but $250.
Depending on what you want, expect.
Exactly. So you don't have a whole lot of movement. Your movement is not strong. So maybe like 1 unit per point is good. Right. Like me, I'm like stronger. Maybe I need like 2 units. A man can be up to 3 units. And same thing for the crow's feet. You don't have any line there. So like 2 units is enough. But some people it's like 5 per point. Yes.
So is that on how deep the wrinkle may be?
It's like how strong the muscle is. And so the stronger the muscle, the more Botox we need. And the reason is like, it's not necessarily that it will not maybe work as well. It's just it will not last as long. Because the goal here is to find that ideal recipe that will last about like 4 months. 3 to 4 months. That's what we're looking for. So let's say we just put like 1 unit everywhere. It may look good for a month, 2 months, but then it doesn't really last, and then you need to keep coming back, right? The goal is to find that like perfect sweet spot. Yes. So now that we have the little recipe, we agree on the price. You're okay with that. This is actually like the needle that we use, so I wanted to show that to you. It's for people out there that knows about needle. The needle is a 31J, so the gauge. So it's a really, really. Can I even I don't even know if I have a zoom.
Oh, yeah.
You see it? Yeah. It's like so tiny. Tiny. Yes. It's like, I would say like a good mosquito bite. Yeah. Like that pretty much the extent of it, okay? So it goes, and usually we just kind of do like three dots. We would just kind of insert it 3 times. So we could, 2 unit, keep going, like about 3 times, and then we would kind of put the needle back in. And then so we put it back in and we throw it out, like there's like bucket like this all over. Drink the bucket. and they're gone, and then we just keep with new needle. New needle, and just we keep doing the treatment. So that's why there's so many needle that we use.
Yes.
To do it, and yeah, that's kind of it. And usually, what takes time, it's really the consultation and, to kind of come up with your recipe with the doctor, the game plan, answering question and all that. The actual treatment is like a 5-minute treatment. Okay. Usually we have the doctor or the nurse injector, depending on who's injecting that day. And usually there's an assistant also. We always kind of work with an assistant. It just helps. And yeah, it goes really, really quick. Yeah. And doesn't hurt. And yes, you can have a little, in some occasion, like some little bit of pinpoint bleeding. Mm-hmm. But yeah, we just ask you to stay straight. Just try to sleep on your back that night. Do your exercise. Mm-hmm. It is normal that things are not perfectly symmetrical, that you could have like an eyebrow a little bit higher than the other, because we don't have a perfectly symmetric face, right? Right. So that's why it's so important that you come back in 2 weeks after, so we can make a little adjustment. And we have tendency to kind of under treat, so it's easier to add and kind of impossible to remove, right? So it's, if there's something, we can add a little bit more. So versus the filler. So it's so what's the okay, so we have a question about being frozen. So when it comes for Botox, honestly, we don't, because it's really, it feels like a mosquito bite, like just a good mosquito bite. But it's not. It doesn't sting. It doesn't hurt.
It's so quick too.
It's so quick. It's just like in, out. Like you don't feel anything. It's seriously, it would be more annoying to be frozen than actually get it. So we don't do it. If let's say you're coming to do your lip or dermal fillers, I've seen myself kind of like, while I'm there, I'm gonna freeze a little bit. Like for a lip flip, I found that one can be a little bit, I never get frozen for a lip flip, but I can understand that it's not really enjoyable. So then I'll kind of freeze that part, or ask someone to just put a little bit of ice. And I think, like, seriously, if you're kind of nervous about it, I think having an ice pack, leave it on, it's better anyway than actually freezing. But if we do dermal fillers, especially lips, I would suggest getting frozen. Like we do freeze for that, but not for Botox. It's not necessarily at all. Like it's too quick, it doesn't hurt. And someone asked about the price per unit. So the price per unit, I guess here at Sparkle it's $12 a unit, but the price of Botox really depend on where, like the product that's being injected, who does it, where you're going. Like that's kind of, and some people charge per area, some people charge per unit. Like same thing, like let's say we do it underarm, charging per unit doesn't make sense. There's so much unit, like, do you know what I mean? Like there's, and versus a lip flip, it's like we inject like 2 points, like clearly it's more expensive per unit than, so there's so many factors, but overall we like to say it's around like $12 a unit. That makes sense. Yeah. So an example for you, like, it could be like 18 units. So, it's rarely like, I would say that most people, it's probably around like 200 to 50 up to like 450, 500. I would say that that's like the price of Botox in general, the average like face of Botox. So I hope that answered your question. Do you have any other question? You think of?
I don't think. Can you inject Botox anywhere more than the forehead?
Yes, you can. So the most common area is definitely like the frown line. Here. Forehead, definitely. So while we're there, there's like injection point that we can do that will raise the eyebrows. The brow lift. Okay. You can do it for crow's feet. Okay. And on both sides. and then you can even use Botox for people that sweat a whole lot. I'm sorry, like my hyperhidrosis. I don't know why I'm losing my words. But yeah, so people that sweats a lot, some people get it for migraines. It really helps. There's other use of Botox. I mean, like I mentioned, the lip flip. Right. It's just you can open the mouth a little bit. To relax that muscle there. So those are like different use that you can use. They're considered kind of off the label, right? It's not like the main use, but yes, it's really common areas. We can even like people that have like the the muscle there. Oh my god, I'm the French in me. I can't translate.
Mandible or something.
Yeah.
I know.
Masseter.
Masseter. Okay.
Masseter. Yeah, the bunny line, the masseter, like the even like a reverse smile, the O here.
Oh, okay.
So yeah, there's just like different way, but those are the one that we it's considered off label, but with the doctors, they can do treatment like that. But
right.
Yeah, so there's a different
There's
use.
lots of different things you can do with Botox.
Yeah. So any other question that you think of?
I don't think so. I think you answered everything. Yeah.
Oh, one question that we get a lot is the difference between Botox and dermal filler.
Oh,
We get that question a lot because one of the most common area that people like wrinkle-wise, it's the nasolabial fold.
Yes.
That's a
definitely.
really common area. So those lines that you have here, and people are wondering like, oh, can I have Botox there? Or, or they heard about dermal filler. And the truth is, you need to realize that Botox will relax the muscle, where dermal fillers will kind of restore volume. And for the nasolabial fold, I would not suggest getting those filled because it's creating more heaviness. It's usually adding more fillers in this area here, lift and under eyes and the cheek. And by doing so, like that line kind of goes away.
Yeah.
You would not inject here. You would kind of lift this.
Oh, okay. And then it pulls it.
Yeah, it pulls it out. And then you remove some weight in the jawline.
Yeah.
Oh yeah, you're like heavy creasing there. Huh? Yeah. Okay. So dermal filler the next video.
Yes.
So I hope this answered your cosmetic injection, Dysport, and Botox question. If you have any more, we'll comment below and I'll be there answering them all.
Awesome.
Thank you.
Thank you.
Bye.
Bye, everyone.